With that, I invite Dr. Santarino Data to share, to talk to us about digital innovations and newborn health.
Good morning. So my presentation this morning has three key concepts: innovation, newborn, and quality of care. And during this presentation, I would like us to take a moment to reflect on what we are measuring for the newborn, regarding innovation, and regarding our quality of care. Let me start with quality of care. So the World Health Organization defines quality of care in many parameters. It says the care should be of good quality if it's effective, it's equitable, it's safe, integrated, people-centered, and timely. And it's geared towards achieving the outcomes that we want. So, if we are to have good quality of care, we must be committed to be able to measure quality of care. Because if we can measure quality of care, then we can be able to move towards the care that we want or sustain the gains that we have achieved. And so to effectively measure quality of care, we need to be thinking about strengthening our health systems in terms of infrastructure for things like health information. We need to think about what we are measuring and how we are measuring them, and whether we have the capacity to be able to internalize what we are measuring. So for newborn care, if we are to do good quality of care, we need to be able to perform our measurements in three different buckets and perform those measurements in all the three. So we need to be measuring our infrastructure and the inputs that go into that. We need to be able to measure the processes, but also we should be committed to measure the outcomes in the ways that optimize what we want in healthcare. So for newborn care, let's look at first the giant killers of our babies and the giant interventions that we need. One of the giant killers is birth asphyxia. The second one is complications of prematurity, and the third one is infections. They really look giant. But let's then focus on the non-giant interventions we need to deliver. They actually sound so simple. We need to keep the babies warm, we need to support their breathing, and we need to feed them. And when we do these three, we need to make sure that we are preventing infections and we are treating these things we need to improve and things we need to improve and things we need to prepare for. So instead, in terms of prevention, we need to be committed to identify high-risk pregnancies and be there to respond to every birth. In terms of performance, we need to be able to deliver quality newborn resuscitation. In terms of improvement, we need to be committed to improve the quality of newborn care we are doing. And we need to prepare health workers to provide all this. What is the challenge of our time? The challenge of our time is that when we train health workers, immediately after training, 20% of them will fail. So time is life for the baby who is born not breathing. And so I'd like to show you an innovation that we can be able to measure our processes so that we are better prepared for the outcomes that we count. The augmented infant resuscitator gives you real-time feedback on your quality of ventilation. So green is good, red is bad. Now I'm in effective ventilation. If the airway was blocked, it instantly tells me that there's airway blockage. If I unblocked it, it shows. There was excessive air leak, it instantly tells me so that I can fix it. Now I'm in effective ventilation with a normal rate. If I started bagging fast, it will show me so that I can slow down. And if I was bagging really hard, it gives me that yellow warning sign so that I can go more gently on the baby's lungs. This device acts like my electronic coach. So when you use the air device for ventilation practice, immediately after your practice session, it will tell you what you have done well and what you have not done so well, so that you can be able to improve. At the health facility level, it can be able to tell you how many people in your facility are supposed to be practicing, how often they are practicing, who is practicing, and the quality of their practice as a facility, so that we can measure the processes. We have used the air device in the SWAP facilities in Kampala and also in many other countries. And now, I would like to tell you what the results are. This data is for 2024. And in 2024, after many years of practice, you can see that our health workers are 20% proficient before training in newborn resuscitation. After training, their proficiency went to about 50%, and they were able to maintain that proficiency up to 11 months. This is not a story unique to Uganda. When the studies were done in Kenya and India, health workers were at less than 20% proficiency before training. They went to 50% proficiency with the training, but in Kenya and India, they were able to push with the use of this device to achieve 86% proficiency at 6 months. The same thing happened in South Sudan. So for the first time in history, we can be able to say skills decay, which has been our big problem, we can fight it. And we can now talk about skills growth post-training. Coming back to the giant killers, we talked about birth asphyxia. One of our giant interventions is breathing support and how we can do that. But think about warmth, think about feeding, and think about infection prevention. How can we be able to measure this? What are we measuring? When it comes to this, our health information systems can play a role, and we need to strengthen that. And with the SWAP project, and we introduced PRISMs. PRISMs is a clinical decision support tool that gives health workers a framework of how to examine these babies. And using these assessment findings, it tells them what they need to do in the primary message and how they need to do it. PRISMs has the potential, as you use it, to seamlessly collect quality of care data so that you can be able to prospectively follow up these babies. At a click of a button, you can know whether the babies are growing well. And it has a feeds calculator and a patient-specific menu. At your facility, as you use it, you can be able to get data on how quality of care indicators are looking like just at a click. So PRISMS brings quality improvement to the bedside. If you have held your hands together to collaborate across institutions, then you can be able to use the PRISMS dashboard to compare the quality of care across your facilities so that you can be able to engage in meaningful collaborative learning. With this technology, I can sit in this room and I do a word round with somebody in Moroto. Very meaningfully. In terms of data quality, this is data from one of the hospitals that is using PRISMS. When they started, the growth of their babies, 50% of them were excessively losing weight at the beginning. But over time, they transitioned most of their babies to be growing inadequately. And I'm sure with consistent quality improvement, they can be able to have more babies that are growing adequately. But this is information they don't need to spend time collecting. They just need to use the technology, and at a click, they are able to visualize it. This technology has elements for ensuring data quality and completeness. So as you use it, it can be able to tell you which aspects of your data collection tools are complete and not complete. It can give you ideas of whether your discharges are completed, because if your discharges are complete in the system, then you can be able to understand what are your main drivers of neonatal mortality in your facility. This is real data for one of the hospitals that are using PRISMS, and so you can see early neonatal sepsis causing 51% of the admissions in that facility. And if we know that, then we know that we need to work with this facility to strengthen their infection prevention. And this is data the Ministry of Health now has information, access to, the facilities have access to, and we can then be able to work together and solve this. And so as we think about quality improvement for newborn care, we should remember that as we enable health workers to acquire skills, we need to be deliberate to ensure that these skills are maintained and that the health workers are empowered to act effectively, and we are measuring these processes objectively. Thank you so much.